This is touching on the field of biomarker, and this is a big problem. And in particular with regard to checkpoint blockade, because you have, of course, side effects and serious side effects, and you are unable at present. There is no biomarker at present that allows you to tell and to say, you know, this patient is likely to respond, or this patient is likely to have not so many side effects. And this is something that, of course, is also worked on very much. This research, of course, will go on in parallel in the vaccine field and the checkpoint blockade antibody field and in every other field. And these are always the same tools that are tested. So basically, one is looking into the tumor microenvironment. That one has realized that this is extremely important. And the other thing is that one looks into the blood, of course, right? One can even pick out enriched tumor cells or DNA of tumor cells and things like that. And what is also increasingly becoming important, and not in the focus here at this meeting, but it is really important, that gets into the focus, is the so-called gut microbiome. So one has learned that the bacteria we live with, and these are many, are influencing the immune system. And people who have a certain bacteria in the gut are more prone to develop autoimmune disease, for example. And in animal experiments, it's very clear, if you exchange the microbiome in the gut, you increase the chances of response, for example, to checkpoint blockade enormously. So this is also something one will learn to manipulate in the next few years. That's a totally new research field, but it's exploding. But it will, get into the cancer field also practically, and clinical trials will run, and one checks, what is happening, and so in trials we are starting. So we are performing a phase 3 trial in uveal melanoma vaccination trial, and we are planning a biomarker analysis in checkpoint-treated patients. So in those patients, we are, for example, already collecting stool specimens for analysis, right? So to check this aspect out.